Without better ado, I'm going to introduce Maaike to you. And her title of the talk tonight is "When a Tongue Tie Release Did Not Help: Why You Should Not Miss a Vitamin B12 Deficiency." And I must confess, I'm really looking forward to this because I would never have thought that tongue tie had anything to do with B12 deficiency. So I'm learning something tonight and really trying to understand this myself would be really great. So I'm just going to read Maaike's introduction. So she's worked for more than 10 years as a registered nurse at the IBCL Lactation Consultant at the Tongue Tie Clinic in Groningen in the Netherlands. She's been a nurse since 1985, with most of her career spent in maternity homes. She qualified as a lactation consultant in 2001, and throughout her career, she's remained critical of mainstream healthcare. Amen. Consistently searched for a better, more natural, and more sustainable approach. I was myself already experiencing many symptoms of B12 deficiency. I tried homeopathy and spent thousands on natural approaches. 14 years ago, I discovered that my sons were unable to breastfeed effectively due to tongue ties. This realization led me to research the subject extensively. As a result, I began organizing lectures in the Netherlands and eventually started treating infants with a dentist. Around 6 years ago, I learned that I myself had been vitamin B12 deficient for decades. This personal discovery profoundly changed my clinical perspective. Very soon, I noticed a recurring pattern. After tongue tie release, some parents returned because problems persisted and nothing seemed to help their baby. During follow-up consultations, mothers frequently shared long and complex histories of unexplained symptoms and diagnostic struggles, which often pointed towards unrecognized or inadequately treated B12 deficiency. I think we could all say yes to that. In follow-up consultations, many mothers described prolonged histories of unexplained neurological, gastrointestinal, or fatigue-related symptoms, often consistent with undiagnosed or inadequately treated B12 deficiency. Infants frequently presented with poor suck-swallow coordination, hypotonia, hypertonia, fatigue during feeding, reflux-like symptoms, suboptimal weight gain, and sometimes slow development. She did this talk last year in Dutch for the lactation consultant IBCL recently and recorded this for IBCL's on the international conference coming online in March. So welcome, Maaike. It's
Thank you.
absolute
Thank you for
pleasure
having me.
to have you, and it's a delight to meet you.
Thank you very much. I'll share the talk.
Yes.
So, when a tongue tie release did not help, that was clear. Why, and then why you should not miss a B12 deficiency. I have no interest or merit in providing this information. I have been working as a registered nurse, as you said, lactation consultant IBCLC at the tongue tie clinic in Groningen for the last 10 years and have gained clinical as well as personal experience on this subject. Any products shown are for educational purposes only. We assume that if you eat healthily, the mother will get enough nutrients for her and her baby. Nutrients, crucial for the development of the brain, like vitamin B12, was studied in 5 countries, as well as D, iodine, selenium, copper, zinc, iron, and fish oil fatty acids. Levels were low in the pregnant women's blood serum and in breast milk. Since we switched from hunter-gatherer to more agriculture about 10,000 years ago, our brains have even shrunk in volume by about 261 milliliters in females. And I put the numbers behind it so you can find in the show in the slides when you get the talk which study it came from. During pregnancy, it's advised to take D, folic acid, fish oil, iodine, and in breastfeeding, the baby gets extra K and D. So I wonder if we're missing something that we as caregivers overlook. So my motivation, so tongue tie treatment hardly helps. So parents come back and say it hasn't helped at all. The baby still or the child still eats poorly and does not thrive. The baby or child may also develop motorically poorly. It turned out that there was a shortage of vitamin B12. The mother is often the prime sufferer from the range of vague symptoms for some time, feeling tired or just not functioning fully, physically and mentally. If mother eats healthily, B12 deficiency is not the first thing a healthcare provider considers to be a problem, even when eating very little animal-based foods, which is the norm these days to eat very little animal-based foods. A few cases that I saw. Two mothers. Both had Munchausen by proxy in the charge after they repeatedly knocked on the GP's office door until they or their child developed serious symptoms that only if then it was finally investigated and in one family adequate treatment of injections was given. So this one son of the mother finally collapsed. That's how low his B12 was. Mother and two children ended up getting injections twice a week, B12. Another mother came to our clinic and asked for a tongue tie release, hoping that finally her baby would start growing. Her baby was still 10% below birth weight at 4 months, fully breastfed. It was already her fifth child. Mother had been diagnosed with B12 deficiency for years and seemed undertreated with tablets instead of injections, and she still had only 125 picomole per liter. So other children, she said, also suffered failure to thrive, she said, and even Safeguard or Child Protective Service also had been notified. Because a mother continues to suffer from complaints for so long, permanent neurological damage or disability can occur, which could have been prevented very easily with the right treatment. If a mother has low B12 during pregnancy, the fetus may also become deficient. When breastfeeding, there may be too little vitamin B12 in her breast milk. A lot of people don't realize that. During pregnancy and breastfeeding, you use more B12. Mothers often complain about feeling run down after the pregnancy. They say it's normal because you started the pregnancy and you're breastfeeding. And worse after multiple pregnancies and breastfeeding, often a reason to stop breastfeeding. So this is a case study. You can find it in the show notes. So refusal of solid food, growth retardation, and relapse in a development in a breastfed child. So this is a 1-year-old boy who had two older brothers. During pregnancy and afterwards, mother ate a varied diet with dairy products, beef, chicken, and pork. Because of gastritis, an autoimmune disease, so you all know, mother did not absorb the B12. She had no symptoms from gastritis. She also had an autoimmune thyroid disease. Well, you all know the talk about from Wolfenbüttel, thyroid, and B12, their partners in crime. Also, her maternal grandmother and aunt also had thyroid disease. For the first 4 months of his life, he grew and developed normally on full-time breastfeeding. On introduction of solid food, he gagged, vomited, refused to take it, refused the bottle, only wanted the breast. He became increasingly irritable. His development was normal at 9 months when he stopped pulling to stand or crawl and spoke much less. He had mild global hypotonia, and he had two small canker sores under his tongue. 4 days after the first vitamin B12 injection, he was much better. His restless behavior and canker sores had disappeared. He became more active, still drank every 2 to 3 hours without gagging or vomiting. After the second injection, he started eating solid food and scurried around the furniture again. They switched to B12 tablets. 2 months later, he ate meat, fish, fruit and vegetables, and mom breastfed only 3 times a day and he also drank whole milk from a cup. And he no longer suffered from the hyperactive gag reflex that we see a lot, and people think it's the tongue tie, and they say they always gag at food. He had started walking independently and used different words deliberately. His weight, height, and head circumference also increased. So, B12, cobalamin treatment is cheap, is water soluble. You all know, as people in this group. B12 cannot be overdosed and it's not toxic, also not during pregnancy, in baby or children, even at high and frequent intramuscular doses. What the body cannot use ends up in the urine. You cannot store a lot of B12, some in the liver. If treatment is given, mother and her child hopefully do not end up in a hospital setting with permanent neurological damage. The right treatment in time can prevent a lot of suffering. Arlette in her wheelchair in this picture says she will make the best of her life. What are my goals? So my goals are that you will recognize the symptoms of vitamin B12 deficiency, that you understand how important it is to act in time because the chance of proving quality of life increases, that you know where to find information and help. I thank ER nurse Sally Patchlock and physician Jeffrey Stewart, who started an awareness campaign in 2014. And they made a documentary of case studies, and I put the YouTube video number that you find in the show notes after, so you can look at the documentary and the motion picture of case histories. And she's also author, you probably all know of the books, Could It Be 12 Deficiency, and the pediatric version of B12, Could It Be B12? So how B12 deficiency is diagnosed, how it is misdiagnosed, and which is pernicious anemia. So I'll just show you this video.
Pediatrician Dave Carr was told he was suffering from a rare, incurable neurodegenerative disease. He was about to die, demented, blind, deaf, and in a diaper, before he was correctly diagnosed with a vitamin B12 deficiency, a condition that would have been easy to prevent and inexpensive to treat if it had ever even crossed his mind. Dr. Carr did not know that low B12 was shrinking his brain and demyelinating his nerves. He did not know that masked B12 deficiency damage can look just like MS or Parkinson's or Alzheimer's or autism.
There's no way in the world in the year 2005 that a vitamin deficiency can do something like this.
And yet, B12 deficiency causes serious problems ranging from fatigue to depression to memory loss to heart disease. What your doctor doesn't know about vitamin B12 can hurt you.
Low B12 levels are associated with a progressive cerebral atrophy.
It's not a placebo.
The neurological manifestations well precede the hematologic manifestations.
Well, let me simply say you can't live without it. Vitamin B12 deficiency, if left untreated, results in death.
Mother and baby need B12 for DNA synthesis, which leads to cell inability to divide when there is a deficiency, may cause cell death or uncontrolled cell division. Production of all blood cells. However, anemia is often only seen in the late stages of the deficiency. Fatigue, neurological and psychiatric symptoms you usually see long before anemia. Converting food into usable energy within the cells. So the metabolism of carbohydrates, fats, and proteins. So even if enough oxygen is transported by the red blood cells, so no anemia, a person can be extremely tired. The production of serotonin and dopamine, production of myelin, so the fat layer in the brain and around the nerves, which can lead to disrupted signal transmission and proper immune function. B12 you only get from animal foods or supplements, so eating little meat is the norm these days. 40% of the Dutch eat little meat, 5% is vegetarian, and in the US even 10%. Meat is also expensive, so people find it difficult to add enough to their food. In the Hindu religion, a lot of these people eat vegetarians. Vegetarians sometimes don't know that B12 should be taken daily. And young women who eat vegan take B12 supplements poorly, sometimes not even not in 3 months. So how complex B12 absorption is obvious and probably all you know. So you chew your food and the B12 binds to protein from saliva, maybe only 3 micrograms. Then the stomach glands here produces heptachlorine, and then the heptachlorine can bind to B12 because of the acid and the pepsin in your stomach. And the stomach cells produce intrinsic factor, but the intrinsic factor should be attached to the B12 in the small intestines, uh, because the alkaline from the pancreas and the bile make heptachlorine loose, so the intrinsic factor can bind. And then later in the ileum, cells absorb B12 and the intrinsic factor. So intrinsic factor needs to be loosened up again for B12 to be transported into the blood with transcobalamin 2. Only 20% turns into active B12. So it's very complicated, as you all know. So the causes of B12 deficiency, you can have an intake problem, of course, by not eating enough animal products. Pregnancy and breastfeeding by a mother with untreated vitamin B12 deficiency, so in a baby who's breastfeeding. Phenylketonuria, because they have to eat low protein, no meat or dairy. You have an absorption problem. You cannot absorb it from food or supplements with your stomach and intestines. You need lifelong supplementation with B12 injections. Antibodies to intrinsic factor, pernicious anemia, absent or abnormal formation of intrinsic factor, which can be hereditary, antibodies to the B12 receptor, reduced pancreatic or gall function, competition in the intestines with vitamin B12, like the parasites and the bacteria. They also eat your B12, so the SIBO. People, malabsorption in the small intestine due to Crohn's, celiac, and the small intestine and stomach reduction surgery, or Imerslund-Grasbeck syndrome, congenital faults in the transport or the metabolism of vitamin B12, disorder in the transport due to transcobalamin 2 deficiency or cobalamin R binder protein deficiency, and metabolic disorder, so the adenosylcobalamin or the methylcobalamin deficiency. So, and there's also suggested it should be tested at the newborn screening in these literature case studies. So that would be really good if that would ever happen, to test B12 in newborns with the heel prick and to test for any disease that is hereditary. So the medication, so long-term use of birth control pill, I didn't know that lowered B12, metformin use, nitric oxide use, so during childbirth and dental procedures, makes active B12 inactive. Anti-acid use in pregnancy and reflux babies, certain antibiotics, alcohol, some certain anti-epileptic drugs, microwave use, or a combination of all those causes. So the B12 Institute in Rotterdam, we have here in the Netherlands. It's wonderful. They're there. They have internists, pediatricians, gynecologists for specialized help. So you probably know about it. The insurances have made a huge wall for people to get there because they have to very often pay 500 euro to be able to for every time they go there. So you just have to have a lot of money to be able to go to get help there. So that's so people sometimes have to look for other insurances to be able to even go there, but then it's very often not reimbursed. So they did a study amongst 160,000 more or less in the Rotterdam area, and they tested to see just basically how their levels of B12 were. And well, you see the numbers. It's under 10 years, about 1 in 10 basically is low, have low normal values. And and then over the 10 years to 65, basically almost 50 to almost 60%. And then they wrote a letter to the GPs, the judge GPs, who published their new standard of care in 2014 of treating B12 deficiency. And they wrote, "We do not agree with your statement. The prevalence of B12 deficiency in Western countries is only a few percent. To speak of a few percent, you underestimate the problem." So I got more figures here. So the 5% of Canadian women of childbearing age are deficient in vitamin B12, and 20% have low marginal levels. They didn't write what the levels exactly were. In Norway, they tested 250 infants. 46% had high homocysteine, and 10% had actual symptoms, clinically relevant symptoms indicating a B12 deficiency. And in Norway, they also tested almost 5,000 capillary blood samples that were collected as the part of the newborn screening program, and 3% were under 100 picomole per liter. So that's a lot. In the Framing and Offspring study, 9% of all ages were very low in B12. Yeah, so you see the levels, the average levels that you want to see. More concerning numbers. The NHS counted in the UK 23-24 192,000 admissions from lack of iron, 11% more than in 2022-23, and 10 times more than in 98-99. And B12 and folate deficiency anemia led in 23 and 24 to almost 3,500 hospital admissions, fourfold since 98-99. B12 treatment involved 38,000 patients from 35,000 the year before. Poverty, they also find, is one of the causes. And then at the GP's office, I read that tiredness and exhaustion is 5 to 10%, and half of them is women. 8% they actually find the cause, and 30% they label as psychosocial, or no cause is found. Yeah, and this is really a concern, I think. To save costs, no B12 is measured during pregnancy while intake of synthetic folic acid is high. Women get advised to take folic acid to prevent neural tube defects. A high folic acid with low B12 can worsen symptoms of B12 deficiency. High folic acid intake is advised to prevent neural tube defects, but sufficient B12 is also needed to prevent neural tube defects. And in the USA and Canada, synthetic folic acid has even been added to flour and breakfast cereals. And I also heard they want to do it in the UK as well. With a specific gene mutation, you also may not be able to metabolize synthetic folic acid well, like MTHFR, which is prevalent in 25%. You end up with unmetabolized folic acid going around in your body. And they did the Pride study in 2021. In 2021, and they found 42% were B12 deficient with high folic acid in early pregnancy, which was associated with gestational diabetes. Also, low vitamin D is associated with the risk of gestational diabetes. You need more B12 in the pregnancy, so low levels could cause a deficiency in mother and baby. The family doctor looks for macrocytic anemia to prove B12 deficiency, but folic acid corrects the macrocytic shape to normal, while neurological damage can get worse. So how can we prevent damage from low B12? My advice would be testing serum B12 before pregnancy, during, and breastfeeding. Test the baby at the newborn screening for B12 levels and inborn errors in B12 metabolism. Taking methylfolate or folinic acid instead of the synthetic form folic acid and avoid food which contains synthetic folic acid at all times. The history of vitamin B12. In 1840, Dr. Thomas Addison described the deadly anemia first, which had a survival rate of 1 to 3 years. And in 1923, doctors found that raw liver dissolved in milk cured symptoms of deadly anemia. And this is an advertisement of around 1913 stating liver extract help with treating anemia after hemorrhage, postpartum, and vomiting in pregnancy and pre-eclamptic conditions. And it was then already liver extract, so because it was horrible, of course, the raw liver dissolved in milk. And those three doctors shared the Nobel Prize in 1934, and in 1947, vitamin B12 was actually isolated as the agent that really works, the vitamin that really does the job. So there are a lot of pitfalls in diagnostics. Blood serum values do not rule out deficiency. To date, there is no test that can determine or rule out a B12 deficiency. You don't measure how much someone has at the cellular level. So blood serum values do not rule out a deficiency in your tissues. Someone can still have a shortage at the cellular level. The B12 deficiencies sometimes symptoms point that out. Testing before someone takes a B12 is a good start. Also, MMA and homocysteine. Methylmalonic acid and homocysteine are not always raised in B12 deficiency. Very high levels of B12 can also be a sign of underlying disease. So it's also a forgotten disease. In the past, so like I heard from Sally Patchlock, trial treatment was started in case of B12 related symptoms, especially with neurological complaints. And US grandmothers who are now in their 80s reported to have had injections in their pregnancy monthly. Treatment when symptomatic disappeared after the treatment codes were introduced, and treatment could not be given anymore without proof from blood work. The new NICE guidelines of the British Society of Hematology, the American Academy of Neurology, point out that in case of neurological symptoms, treatment is required irrespective of the serum reference ranges, because if treatment is delayed, more neurological damage can occur and end up being irreversible. The GP can start that up, usually 10 injections in 5 weeks. If symptoms start subsiding, treatment should be continued. It is really the only way to know for sure that it was B12 deficiency. And treatment should not be stopped with rising blood levels, and not in pregnancy and breastfeeding, as I heard from several mothers that the gynecologist said we'll stop the injections during pregnancy. And breastfeeding is not toxic and you cannot overdose, so luckily for that. Yeah, and then many physicians are not familiar anymore, as you know, with the signs and symptoms of low B12, so an epidemic of misdiagnosis occur. So as you see in this nice pamphlet that the B12 deficiency.info made, so you can see the B12 deficiency induced neural tube defects and the inborn errors of B12 metabolism in babies. Maybe this child is misdiagnosed with autism, MS, bipolar. Also, men can be infertile because of B12 deficiency, postnatal depression, misdiagnosed with Alzheimer and suicide. So really, it's a serious problem. I think we should not overlook, and also the misconception that B12 only affects women over 60. Ignorance that really can cause a lot of harm. So there's a few cases here. Again, infants with B12 deficiency are often born normal, but may present at 4 to 10 months of age with failure to thrive, anorexia, development developmental regression and pallor from megaloblastic anemia. There have also been cases of severe disease with acute encephalopathy, seizures, and microcephaly. So the brain actually shrunk. Delayed myelation and demyelination have also been reported on magnetic resonance imaging. And there's this case of a child with a juvenile pernicious anemia with severe delayed growth and motor development and not transitioning from the breast to solids. Sleeping much. A swallowing study showed pooling of the formula in the mouth and delayed swallowing with thin and thick liquids. The MRI revealed generalized brain atrophy with a reduced amount of white matter. So what does B12 deficiency look like in the families that I see? Well, the baby has a poor latch at the breast or the bottle. There's a poor milk transfer from the milk to the mouth to be able to swallow. Doesn't even seem hungry, what I hear from parents, even refusing to eat. They may be vomiting a lot, choking on food, failure to thrive, so actually not growing normally, sometimes neurological or motor developmental delay. Tongue-tie treatment only helps for a short time or not at all, or even worse sometimes. And the mother has symptoms of B12 deficiency. She maybe have had hyperemesis in the pregnancy because that sickness could be already B12. I already heard from a mother who hyperemesis stopped after B12 injections. Tiredness, depression, infections, always a lot of infections, cannot work full time, generally unwell, treated for depression, anxiety, or other mental conditions. And they went to the GP, but the B12 values were always within normal range, and they had no anemia. So the symptoms of B12 deficiency in women of the childbearing age, it's a lot. They say, I don't live, I merely survive. Complaints often develop slowly, like a peat fire, usually general unwell feeling, fatigue. The symptoms can be very diverse, so you don't have to have all the symptoms. Not being able to work very often, not completely, poor concentration, forgetful, even word finding problems, brain fog, headaches, migraines, overall severe fatigue. And I very often ask, have you been, do you ever suffer from burnout? Or they can have muscle weakness, muscle pain, heavy legs, dizziness, fainting, blurred vision, ringing in the ears, and so POTS that when you get up, you're dizzy. Heavy periods, infertility, miscarriages, premature birth, low blood pressure, anemia, no appetite, nausea, hyperemesis, this spitting up, skinny, but also overweight. I very often see looking pale. Not always, but you very regularly see it. Also in the baby, this baby can look so pale. Tingling hands, feet, feeling of walking on cotton wool, restless at night, numbness, paralysis, even weakness in the legs, sleeping hands and feet while you're in your bed at night, clumsy, walking against the doorpost, dropping things, spasticity and stabbing tongue pain, canker sores, red flag tongue, landscape tongue, atrophy of vagina mucous membrane, so that causes pain, false positive pap test. I heard from one mother also, and hyperpigmentation, hair loss, gray early, vitiligo, thin hair implant. They can be very easily irritated, have mood swings, anger, bipolar, depression, psychosis, suicidal, anxiety, postpartum depression, postpartum psychosis, increased susceptibility to infections, urinary tract sinuses, unexplained fever or cough or hoarse, shortness of breath. So what do I ask the mother when I see them? Whether she is familiar with the symptoms that fit with B12 deficiency. Ever had blood tests? How is her energy? Does she work? Is she overworked or extremely tired? Does she have a real history of burnout? If she had diagnosis of B12 deficiency, because I very often hear that they already were in search of if it is B12, they receiving treatment also during pregnancy, or was it stopped? And does she think it resolved the complaints when she had the B12 injections? Pregnancy and breastfeeding requires more B12. Did she have complaints since the pregnancies? I had a mother who had 15 years ago, she had a gastric bypass and she had 3 children since. And she had a lot of complaints. Oh, she was saying, yeah, I'm very bad at taking the supplements that I should be taking. But of course, if so much of your stomach is taken away, then you don't absorb B12. You really have to have injections. And she came with 3 children to the tongue tie clinic. And funny, the middle son was also not developing well. He was not crawling and walking, and he was at the physiotherapist to try and persuade him to help him to to try to move more and to become more active. And as soon as he started normal food, because he was also not eating well, and after 1 year, he started to eat like normal, like also meat and stuff. And then he started to develop suddenly a lot better. So, this is how it can go on to the child. So how were the previous pregnancies and feeding the babies? Did they grow and develop well? So I often hear that, oh yeah, the other children were also not feeding well, growing well. Unfortunately, also vegetarian mothers who were never able to breastfeed because the baby just couldn't latch on properly, and came to our tongue tie clinic hoping that the tongue tie release would finally make them latch to the breast better again, which didn't work. And then I asked about B12, and they say, yeah, I'm vegetarian for 15 years. And so I stimulate them to get it sorted out. The B12. So what was mother like before the pregnancy? Did she have fertility problems? How was the pregnancy? Did she have a hyperemesis? I had one mother who was still so weak after a hyperemesis pregnancy, and she only got 2 injections of B12. And it took her years to get her brain working again. She was really very tired. She had needed help at home after the delivery. She was so weak. She needed help to get in the shower and in the house. And she just kept coming back for, does she need another release, because she's still not drinking her bottles well or eating well. So, and then I kept saying to her, really, get your B12 sorted out, because you only had 2 injections and you still have many of the symptoms. And so that's difficult with a patient who's B12 deficient. She just didn't have the brain to get it sorted. So, and also the pediatricians wouldn't check B12 because she was eating so poorly. So it's very difficult here in the Netherlands as a nurse to say, look, maybe you should really get it sorted, but then they come to the GP and the GP sometimes get angry. I also had a GP who started somebody vitamin B12 injections right away. But so we get a lot of hassle from, basically doctors who say, well, what is this B12 and who's saying that? So, we have to keep a low profile on that, because, we're already, as being a tongue tie clinic, sometimes doctors find that also difficult to understand that we do tongue tie releases. So the postpartum, did she have depression or even psychosis? Should always be tested for B12. A diet with minimal animal products, family members maybe, because then I hear, oh yeah, my sister just started on vitamin B12 injections. Oh, and I say, well, and do you have the symptoms? Yeah, my dad, so the baby is drinking poorly. So her sister is on B12, and she herself has all the symptoms of vitamin B12 deficiency. So I see that often. I had two children who came who never drank more than 30 milliliters from a bottle. So only 30 milliliters, very little, until 9 months because they were never able to drink more. And so they come to us for a B12, for a tongue tie release, but that doesn't seem to help. So so it's difficult to get help in that, especially with children, because they think it's sad or not nice for the children, of course, to have blood taken, and then maybe they need injections. So they're very much against looking into symptoms with children. Um, Maybe she has been diagnosed already with multiple sclerosis, fibromyalgia, ME, CFS, long COVID, burnout, Lyme, medically unexplained physical symptoms. So maybe in the family there's autoimmune disease, celiacs, Crohn, now all the other autoimmune diseases. And maybe she's been on metformin or used a pill very long, antacids, stomach reduction surgery, vitamin D deficiency, which seems to also, you see more autoimmune disease in vitamin D deficiency. Maybe she has iron deficiency also because it's very big. So this patient, this lady, she finally got B12 injections, and the picture above is her looking so pale. She said, "Yeah, you kept saying to me, you look so pale," and her baby was, of course, not drinking well. And the child, when he got a little bit older, was really when he walked he would fall over really easily, and they started him on the B12 drops, and he got so much better because now he was able to run without falling since the B12 supplementation. So she was very happy, and I was allowed to put her pictures up here. So this is also a YouTube video, BBC documentary about this young woman diagnosed with multiple sclerosis, which is of course also an autoimmune disease against your myelin sheath. But she saw GP Dr. Chandy and helping patients with B12 deficiency, and thought it was she needed B12. And after the first injection, she was able to stay up longer in the evening and walk to the bathroom normally without it being a problem. And she had a mobility scooter even, but it was no longer needed for walking. So she was very happy. And like Dr. Shandy was saying, giving B12 injections in case of a deficiency is like watering a plant after the holidays that hangs down and it's standing up again the next day. So it's really beautiful to see that. And this is a young woman who filed for a medical negligence lawsuit, and she won it. She kept going back to her GP with symptoms of B12 deficiency, and she was sent away every time because her complaints were all in her head, as she was also on antidepressants, until she became numb from the waist down and could no longer walk. And she received the injections of B12 too late, but she won the lawsuit. But it never brings her back on her feet again, of course. So this mother had nitrous oxide, gas and air to relieve pain during birth. And she became bedridden. The doctor wanted to prescribe antidepressants. So it's really awful. She had a drop attack with her son in her arms, and like she says here on the picture, she thought she was going to die, really, and about how you can feel with the deficiency. And this is also another YouTube talk of this mother of three daughters, Daphne Hatz. And she was already on antidepressants against postpartum depression, had terrible migraines and backache, and she needed a lot of pain relief for that. She thought she had ME or chronic fatigue syndrome, long COVID, Ehlers-Danlos syndrome, SIBO, MSAS is MTFHR, chronic illness. So she had extreme fatigue. So she's put all on the video all these pictures lying there in front of the fridge. She just had to lie all day. She had to give up her job, migraines and back pain, spasms in her hands, bruises, landscape tongue. And they said, well, you just have Munchausen by proxy. It is all in your head. Every time she went to the hospital. Finally, she got through to a natural doctor, and they tested her, and she was positive autoimmune against stomach cells, but also against her folic acid receptor in her brain. And she had full recovery in the end by injections of B12 and natural methylfolate or folinic acid she took. And yeah, I just wanted to write here also that high blood serum B12 could also be a sign of other serious conditions, which you find in that study. So symptoms in the baby and child: poor vacuum on the breast or bottle, very often not very tight type tongue, the type 4 tongue tie, so it's really in the back, you hardly see a tongue tie. But we do have good results releasing of a type 4 tongue tie. And so it's not like a type 4 tongue tie is always B12, but so you can have the tongue tie all the way to the tip. And that's a type 1. But a type 4, you hardly see a tongue tie. But still, it can be very anchored to the bottom of the mouth. So you can see that difficulty swallowing also with the tongue tie, but if you cannot move your tongue up and back and swallow because of the tongue is being pushed down at the bottom of the mouth, you also see difficulty swallowing. So, but with B12 deficiency, the swallowing nerve can be affected. So you can see a decreased sucking reflex can also be seemingly no hunger. They just seem to be not hungry, sleeping all the time, or crying a lot. So I see a lot of people come back and they say, yeah, we just have a crying baby. This baby just cries all the time. And there are so many symptoms of B12 deficiency. But they seem to be no hungry, even refuse food, nausea, sleep long, does not switch to bottle or solid food, eat little, overactive gag reflex, belching, spitting, vomiting, silent malnutrition. So they can look really pale and skinny. But I've seen a huge baby, but it was so hypotonic and drinking poorly. I said, well, the people from Denmark, we get a lot of people also from Denmark, Germany, everywhere, because in tongue tie we're really very specialized. So, but they went back to Denmark, and this baby was B12 deficient, so they tested him. But you can see very often the failure to thrive, small, skinny babies, with also it can be the head circumference too small. So this is really a red flag because you want that brain to be able to grow. They can be apathetic or very easily overstimulated. They did the study in Amsterdam, a big study, and the mothers with low B12 very often had a crying baby. So that's what I tell those mothers. And you can see little hair growth, shortness of breath, prone to infections, developing delayed or regressing, does not start turning over, for example, sit, crawl, stand, or walk. paralysis, falls, muscle weakness, low tone, convulsions, even tremor, abnormal movements, rooting reflex of food grasping reflexes that stay too longer, jaundice, breastfeeding icterus, moderate language development later, cognitive decline, memory and concentration problems, behavioral problems, insulin resistance, anorexia, and can look like attention disorder, autism, but they cannot stick to a task for long or have an angry disposition and mood swings. So how does the baby drink? I asked this mother. So you see, there's a mother who has the milk in a little bottle with tubes. So the baby is getting it also from the bottle and also sucking at the breast with a nipple shield. Because this baby just doesn't get enough just drinking from the breast. So that's what we sometimes see. And it could be a sign. But hopefully with the tongue tie release, usually when there's a really tight, short tongue tie, they do get better at drinking milk, transferring milk. Okay, so they put when they drink from the bottle, they put a bigger hole in it, and still the baby takes hours to empty a bottle. So how many milliliters do they actually drink? How frequently is that? So they have to sometimes they say, yeah, it takes 1.5 hours to empty a bottle. And they're just chewing on it, just, yeah. And so they refuse often the bottle. So, like I said, there are 2 babies who never drink more than 30 ml until 9 months, drinking the 30 ml all day. So they have a poor weight gain, maybe the head size also not following the curve. Do they use supplementary feeding? How's the motor development? Has the baby started to turn over, sit, crawl, walk, or does he or she regress? Doesn't sometimes seem to be hungry, nauseous, gagging, spitting, vomiting, refusing solid food, refuse to switch to bottle, or refuse to stop breastfeeding. The appearance can, look like thin, skinny, sucking on knuckles, these babies all the time sucking like they're really hungry, pale, hypotonic, and you can see involuntary movements. So crying a lot or sleeping a lot, silent malnutrition, as we call it. And maybe, there can be icterus, and they call it breastfeeding icterus. But if the mother doesn't have enough B12, maybe this blood is being not made well and is being put. How do you say that in English? So this baby ends up being yellow for weeks. So it can be the first week that the baby is a little bit yellow. You see that often, which is normal. But if it stays for weeks or maybe a month or longer, then maybe it could be also a sign of vitamin B12. Nobody ever talks about it. Nobody ever. I don't hear that ever anywhere. So this is also a real case history. It's in that movie they made of Sally Patchlock working at the ER, and that really shook me because that case, I saw that film, and this baby, he was already 1 year old, and the mother was a long time vegetarian, and he refused solid food, and he was not active. And the doctors first gave antibiotics and later a tongue tie cut, but he died 2 weeks after the tongue tie release of a severe B12 deficiency, as the autopsy showed. Became a lawsuit, but yeah, the hospital did adhere to their protocol, and that's of course what Sally tried to do, is change the protocol. Low B12 in mother and baby, resulting in permanent brain damage. You can find the YouTube video in the show notes. And this is a really very severe case of this boy.
had postpartum psychosis, and they were both B12 deficient.
That's well known. I mean, depression, psychosis, they should always be checked for B12. There are women who have actually killed their children or killed themselves. And you wonder, they had that. Was B12 a cause? Nobody's testing. We don't even know the true incidence of B12 deficiency.
One of them had thoughts about wanting to kill her baby, and she was depressed about that. And she had just given birth a few weeks ago, and so we tested her, and she was positive. So I treated her in the ER.
In the United States, over 5 million vegetarians, and a lot of what happens with the children is that mothers who are pregnant, like say they've been a vegetarian for 10, 15 years and they get pregnant, and then their breast milk doesn't have enough B12, those children can become severely B12 deficient, and they can have a brain injury.
Lennon is 11 years old. He has brain damage that could have easily been prevented if his doctor had known the signs and symptoms of B12 deficiency. At 9 months of age, Lennon had dysphagia, that is, difficulty swallowing solid food. He then experienced failure to thrive and weakness and pallor. He was misdiagnosed by 3 pediatric specialists, including a pediatric neurologist, who told Lennon's parents that he had a rare and incurable neurologic disease of unknown cause. Sound familiar? Lennon started getting the right medical treatment at age 2, but by that point, some of his acquired brain injury was permanent.
Lennon is in 5th grade and he's in special education. One of the hardest challenges for him is his inability to stay on task and pay attention. Handwriting it's very, very difficult. He's not able to really write assignments of any length. He definitely struggles in school.
Lennon had been a typical happy baby until 9 months old when his eating regressed.
And our doctor assured us that breast milk was 100% nutritionally complete. We were concerned about his development, that he wasn't able to really turn over good at 15 months, although he had done it before.
He's a sack of potatoes. His head just flopping around. And we again expressed, something is wrong.
Lennon had become an unhappy baby who was prone to infection and slow to heal. He acquired noticeable tics and repetitive gestures, as well as shortness of breath.
He would sit around and pull his fingers and do his lips, and we kept bringing it up to the pediatrician, and I think his response at that time was, well, he's not doing it now.
We trusted him. He was the head of pediatrics at a major hospital here in Birmingham.
By age 2, Lennon had severe neurological problems, and the family was told nothing could be done. Only after gathering his medical records did his parents realize that he was dying of B12 deficiency.
He had all the classic symptoms, pale skin, pale lips, weakness, floppy muscles, you name it, he had it.
Lennon's B12, homocysteine, and methylmalonic acid were all abnormal.
Homocysteine, if your levels are over 15, you're at high risk for a stroke, heart attack, and his was 89.7. Basically, he was building up some toxins in his body.
As soon as Lennon was put on B12 shots, he began his recovery, and he began eating solid food.
After he had been on the shots, he was a happy baby like he had been early in his infancy.
So it's a very sad story. This is a family also on a very strict vegetarian diet, and the mother breastfed, but the development and weight started to lag behind. And she was 7 kilos at 14 months. So that's very, very little for 40 months. So the neurologist saw a skinny, hypotonic, few spontaneous movements in her, some involuntary movements, and continuous rolling movements of the tongue. She still had a positive food grab reflex and rooting at 40 months, which shouldn't be there anymore. After B12 administration, iron, folate, and other vitamins and minerals, she said independently, crawled and stood with help, and muscle strength and reflexes almost normal at 20 months. So on the top pictures, you see the underdevelopment of the brain and at the bottom pictures, you see after B12 injections, the recovery. There's a large vegetarian community in India, and they have this infantile tremor syndrome. And they see it in B12 deficient babies because they found out that giving them B12 injections, they got better so quickly. So they checked 27 babies that were all exclusively breastfed by vegetarian mothers. They had developmental delay or deterioration, paleness, hyperpigmentation. You see that on the picture of the skin and little hair. Majority were hypotonic and involuntary movements were found, and anemia. After treatment with B12 injections, within 48 to 72 hours, a dramatic improvement in general activity and appetite, followed by return of normal development, and the convulsions disappeared in total within 3 to 4 weeks. Dietary vitamin deficiency is a treatable cause of neurological dysfunction in infants. Typical is the continuous mobility. I'll show you the video. You can find it on YouTube. Typical is the continuing movement of the tongue and the goat bleating sound that the doctors in India consider a red flag for B12 deficiency. Yeah, have a look at the video in the show notes. Yeah, there's the number there. Yeah. And these are two cases of two children in the Netherlands in one of the Dutch hospitals, and it was in the GP a magazine for GPs. Yeah, so that was a 7-month-old baby, deviating growth curve from 3 months, fully breastfeeding, pale, dystrophic, hypertonic. Clearly, the head lagging behind when being pulled up. He had a developmental delay of 4 months. During admission, the patient developed generalized convulsions several times, and the EEG showed normal activity without an epileptic focus. Severe anemia he had, and only a B12 of 62, with high homocysteine and methylmalonic acid. Also due to vitamin D deficiency, rickets had been diagnosed, and the mother ate vegan, and her B12 is 96. And that was this 23-month deflecting growth curve and development, and refusing solid food, almost exclusively breastfeeding. At only a development level of 6.5 months. He pulled himself up, but hardly crawled and did not walk. B12 level was 69 and the mother 191. Treatment was initiated with vitamin B12 injections, a week, 1,000 micrograms, intramuscular 5 times, and the diet was also adjusted, with the child also being offered animal products. At 28 months, the level of development is now of 12 to 15 months. So he's still a year behind. And I found this study also of the ratio of vegetarian and pernicious anemia in failure to thrive children. Only one paper that I found, a French paper, 100 failure to thrive cases, and 2/3 was from vegetarian mothers, and 1/4 had undiagnosed pernicious anemia, autoimmune gastritis. And so I want to talk also about the link between low vitamin D and autoimmune disease, because it seems that, with autoimmune disease, if you start attacking your own stomach, B12 deficiency is around the corner really quickly. So they also found that multiple sclerosis is rare at the equator and earlier, if in pregnancy, not living near the equator. So this sunshine seems to be also very important to maybe also prevent autoimmune disease. So you can have Sjögren, PA, celiac disease, Crohn's. So eventually you get malabsorption and B12 deficiency. And for example, in a study in Sweden, 50,000 people were tested for celiac disease. 2% were positive, but 70% never had any symptoms. Also, in pernicious anemia, autoimmune gastritis can go unnoticed for so long. And you can have only vague abdominal complaints. There was this study also, 5% of women of the childbearing age suffer from autoimmune thyroid disease, and up to 1/3 of these develop pernicious anemia. Because the thyroid and stomach are in the same embryonic phase, they are more or less maybe linked in that sense. I don't know. Most of whom are asymptomatic. So in a study, patients with juvenile autoimmune thyroid disease, they found anti-gastric parietal cell antibodies. So, also young children can also already have autoimmune thyroid disease. So the vitamin D deficiency, the effects of low vitamin B12, preterm birth, asthma, preeclampsia, and gestational diabetes. So there were these pediatricians in Texas who did randomized controlled trials, and they recommended a much higher supplementation during pregnancy and lactation. So 4,000 IU a day in pregnancy and 64 IU a day when breastfeeding at a normal blood level, because a lot of mothers are low because they never see sunshine. And even if you are living in a warm country, we spend a lot of time indoors with the air conditioning. And then the black population is very high at risk because you need to be in the sun 5 times longer to be able to make the same amount of vitamin D with a dark skin. Then there's iron deficiency is really number one worldwide, especially in women in the productive age. So both iron and B12 are essential for production of red blood cells. Iron from non-heme source, plant-based food, is less absorbable than heme iron in meat. So 2% from spinach, for example, and 15 to 35% from animal sources. And then chicken is very white, and fish, so that doesn't contain. So you really want the red meat. But yeah, we don't want to eat so much more red meat. High oxalate food binds to iron and other minerals. Like if you eat a lot of vegetarians eat a lot of almonds, spinach. People love chocolates. There's a very high in oxalate. Beets, kiwis, sweet potatoes, a lot of food high in oxalates. Polyphenols and tannins in plants bind to iron and other minerals, like when you consume wine, tea, and coffee. So having a glass of wine with your steak, maybe such a good idea. Also, phytic acid in grains and legumes. Calcium-containing food diminishes iron uptake, and vitamin C increases uptake. Yeah, our responsibility as care professional, I think we should inform the patient immediately if you think there's a B12 deficiency. With good help quickly, there is a chance to full recovery or minimal neurological damage. That lady that I talked about, that was one of my patients. You saw her pictures, who was so pale. She was already at her neurologist with numbness in her feet and tingling. And she's in her 30s now, so that's probably not going to go. So point to patient support groups, special letters for the GP and the needs and the NIH guidelines. So the patient goes well informed to the GP. And a second opinion may be required by specialized physicians. How to look for help, really let them join patient groups, for example, on Facebook, B12 deficiency groups. So they read the experiences with seeking help from other patients. That's very good. So because many doctors do not recognize the signs and symptoms, or they think it's a hype. Very often I hear that back. So gain knowledge and come to the doctor prepared. It's important to do not start taking B12 immediately, but first have blood tested. The general practitioner or pediatrician can be reluctant to look further into B12, particularly when serum levels are within range. So the next step is to produce these guidelines of the British Society of Hematology or the American Academy of Neurology. The guidelines point out that in case of neurological symptoms, treatment is required, irrespective of serum reference ranges, because if treatment is delayed, more neurological damage can occur or end up being irreversible. In search of specialized doctors, I put a few names, websites, addresses. If you know more good doctors, or please give me your websites, or so I can put them in there as well for people to maybe find somebody who can actually help them to get proper treatment. So you can send that to my email address. These are websites that I have there. So my conclusion is B12 deficiency is quickly overlooked if the mother is deficient, so is the baby. Mother's milk is also deficient. There's too little knowledge in caretakers. These days, more autoimmune disease in young people also. Consumption of meat is very low in the general public. Treatment too late can result in permanent neurological damage, and high folic acid can lead to worsening of B12 deficiency. So here's I've got just the example of the injections that people can get. I suppose you all know about this. So thank you for your attention.
Oh, thank you so much, Maaike. That's really, been a very interesting talk. I've learned a lot, actually.
You did. My
Thank you.
goodness.
Been in this field for 40 years, but I'm still learning,
I never thought that, when I started working at some clinic, I thought, oh yeah, I'll do this too. I'm 62 now. I'll do this too until I get my pension.
Yes.
Oh God! But then you just find this underlying B12 deficiency that people can have, and it's just really. So
It's
I'm into B12. Yeah.
yeah, that's right. Okay, so there's a few questions on the chat. And the first one, it seems to be from Jay. So Jay is interested in
Jay.
the association between vitamin D deficiency and how the test is accessed in the Netherlands, and what does it measure? I assume it's probably the same across the world, to be honest, but there we go.
Yeah.
It maybe isn't. And then there's a little bit later from Jay talking about he was glad the association you made, because you did the vitamin D bit there before his question came up. So, and of course we know that, vitamin D isn't vitamin D, it's a hormone, but that's a whole other subject.
But
That's a whole other subject.
it's too
So,
much for one.
yeah, it is.
Lecture.
So his question is, so the Netherlands, what's the
In the
access?
Netherlands, it was actually reimbursed, the vitamin D supplementation when it was low, but they find low B12 D levels, they find normal. So, and they took it out of the package of the insurances. So now you have to buy your own vitamin D at the pharmacist or the drugstore, and so they already say, oh, your D is fine with low levels. So you really should get up to. So in the Netherlands, we have 100 nanograms per milliliter. That should be 80 to 100 nanograms per milliliter. Yeah. So, but with 50, they already say, oh, fine, don't do anything about it, or take some vitamin D from the shop, yeah. So.
Yes, and the levels, we could talk all day about reference ranges, couldn't we?
Yeah.
And how they
Yeah.
are arrived at, and when we look at the research for, particularly for vitamin D, but a lot of research shows that, if it's less than 120, cancer survives, and you
Yeah.
boost the immune system by, get over that, and that's a good thing. And obviously the levels of vitamin D are quite, given out by the WHO and others, are very low. Um, and
Yeah.
and so therefore, your studies are showing quite high doses, and we got
Yeah.
people 10 and
For
20.
in mothers breastfeeding and
Yeah,
in during pregnancy, 4,000 IU. But the doctor will say, oh yeah, 800 is enough. It isn't.
no, it's not.
At normal levels. So it's randomized controlled trials. They can find it in the show notes. I mean, it really is. Vitamin D is so underestimated as well. So it's another huge problem.
Yes,
Yeah.
yes, it's a whole ball game. It's a
Yeah, I wouldn't know the exact
This is people who go down the sort of traditional routes of NHS and what's available in the NHS and the systems that we have in the UK. And there are many other ways of getting things done, but they're not affordable. Like you were saying, the B12 Institute in the Netherlands is great, but it's
you don't get in
not
there.
affordable for people, and that's a
It's
difficult
not
thing.
affordable anymore. No, they don't reimburse them anymore.
So
Even
there
to
are.
go to Dr. Wolfenbüttel, who spoke last time, to see him, yeah, your doctor shouldn't say you're going there for B12 because then it's not being reimbursed.
Wow, yeah.
It's just so sad. It's really B12 is yeah.
It's political stuff. So the next question is B12 deficiency linked to IBS disease? That's John.
IBS is
Irritable bowel, I assume you're talking about John, are you?
irritable bowel syndrome. And
Yeah.
so you see, of course, people with irritable bowel syndrome symptoms, they have everything. So people come with bloating and abdominal complaints, and it's IBS. And what is IBS really? Tell me.
Yeah.
So, but most important is that you don't have an overgrowth of bacteria in your small intestines, because then they'll eat or parasites, because they'll eat your B12,
Yes,
so
yes,
it's
yes.
yeah,
So you get SIBO and stuff like that, and that's that they're the issues really underlying this, what we term irritable bowel syndrome or disease.
yeah. So you go to your doctor and they'll say, oh, you have irritable bowel syndrome. Yeah, but what is it really? Is it really an illness?
Yes, it's all. So, John, I think the answer to the question really is all about gut. I think we're
Yeah,
being educated in the last 5 to 10 years, I would say, certainly myself, on the connection between the gut and the brain, vagus nerve, all of that stuff, and
yeah,
and and parasites and stuff. There's a lot of
yeah,
information out there about it, and I think that I would say absolutely it's associated.
yeah,
It's
yeah.
it's just given a name that's
Yeah.
encompassing many things.
Exactly. So they just go away from the doctor. Oh, it's just IBS. Yeah. Well, what are you going to do about it? Stop eating gluten. What people do, they get these supplements with good bacteria in there, so the probiotics, or try to do anything about it. And maybe it's just B12 deficiency because you're not absorbing, so you get abdominal complaints because maybe you have Crohn's or celiac or pernicious anemia. So
So yeah, I'm looking at research at the moment, and it's pretty good. Be able to
yeah,
tell you what type of B12 suits you, and which type of suits you personally. So sort of like a personalized approach. So it's never cyanocobalamin usually, but it is there. We're going to be able to. I think in the next 6 months or so, I should be able to tell people what type of B12 suits them. without having to do much and just through particular scanning and stuff. So is treatment for parasites recommended? I am not really a parasite expert. I think you can do quite a bit of research on that. I don't know what Maaike thinks about, you've probably got a lot more experience in the parasite realm than I have.
I would know. No, I do take parasites. Just the one from the pharmacy that you buy is really cheap. It's mebendazole, and treat myself every now and then just in case, because you don't really know. They don't test for all the parasites anymore, so it's very difficult to also find out whether you have parasites. So I eat a lot of meat because I think we should. I'm actually tried to, well, first gluten and then milk, and then you start eating less and less, and I'm still had this huge belly, indeed IBS, whatever, always
Yes.
having complaints. So yeah, I'm taking antiparasite, just the one from the pharmacy that you can just buy.
There are anti-parasitic regimes and stuff that are out there. If anybody
Yeah.
wants any information, I can point you in some directions, but I'm
And
not.
test for H. pylori is essential. Yeah.
Yes.
I'm gonna have myself tested again for H. pylori, because I just keep having these abdominal complaints, and I'm not there yet either.
I think one of the things that we should refer to as celiac.
Yeah,
Again, along with thyroid, celiac is quite prevalent amongst people with B12 deficiency. It's quite high up there,
yeah,
and a lot of people, possibly don't associate that, but it's very often, one of the
yeah.
things that comes up.
You
Um,
don't notice it. You don't notice your small intestine. So the villi are straight. There's no villi anymore. So you don't absorb the
yeah.
vitamins out of your food. So it's really quite bad, and people don't notice it.
Yes. And so I think there's a general question about the most effective way of taking, folate and B9
Yeah,
um, is
yeah. So
recommended. So can you expand on that maybe and how
yes.
folic acid contributes to B12 deficiency? So it maybe
Well,
expand a
it's
little
all
bit.
the unmetabolized
Yes.
folic acid going around in your body, and your body can't transfer it to usable folate. So, and that seems to damage even and make the neurological symptoms worse. And also make the how do you call that, the megaloblastic anemia go away, the folic acid. So yeah, but really, people should be aware, especially when you want to get pregnant, or to have enough B12, but also get the folate and the folinic acid, just to make sure, without even thinking, don't get folic acid, because a lot of people can't metabolize it well. So you have a shortage of folate, one thing, because it doesn't get in your brain, the folic acid. Yeah, so, and there's also a receptor for folate in the placenta. So it first needs to go past the placenta, and then it needs to go into the brain of the child. So if there's already not enough going through the placenta, folate, maybe the baby doesn't also get enough in the brain. So, especially during pregnancy, a person should not, a woman should not have folic acid, the synthetic version. Yeah.
Yes. So we would probably be looking at folinic acid and
Yeah, folinic
methylfolate
acid
as
or
the
methylfolate.
yeah,
Yes. Yeah.
as two kind of
And you can also make antibodies against the receptor.
yes. It's also
Yeah.
important, isn't it, Maaike, to have the folate at such a level, a higher level in the blood, and the ferritin at a level, the iron at a
Yeah.
level, that
Yeah.
you can take up all the B12 and it works better. So if
Yeah.
if you're on B12 and you're not finding any relief, symptoms, possibly your folate's low or your your ferritin's low, and
Yeah.
these are two. We often find these things work synergistically together, don't we?
Yes, 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 yes. So and also B6, of course, you need, and
B6,
B1
yeah, active
for your
B6.
nerves. Yeah, the active B6.
Yeah.
Yeah, and the active B1, because you can take thiamine, but you rather have benfotiamine because it's
Yes.
already in fat, so it can be taken up by your myelin sheet quicker, or into your nerves quicker.
Yes.
Yeah,
Yes.
benfotiamine. Yeah.
So B complexes are quite good for people with high homocysteine, for example.
Yeah.
If
Yeah.
they've got high homocysteine level, B12 will
Yeah.
bring it down. I
Yeah.
had somebody a couple of weeks ago whose homocysteine was 20, and
Huh? Yeah.
after one B12 injection, it's 7.
Yeah.
It's a
Oh, yeah.
remarkable difference. And
Oh,
started on B complex as well. So
yeah. Very good. Just taking the
two
the
weeks, only
complex.
2 weeks. Yeah, it was
Only 2 weeks.
only
That's
2 weeks.
amazing.
It was quite a good result. Yes, I
Oh,
thought
that's
I'd
so
weigh that one
nice.
up.
And did
Yeah,
they feel better? Because that's the most important thing.
yeah, amazing.
Oh, man, people are suffering so much. I have these mothers, and they have these histories of most horribleness. Today, there was this lady, and she was diagnosed. A lot of people have, how do you call that? Oh, it's sometimes so I think in Dutch, and then uh, they have a lot of period pains, and and they can
Like endometriosis or
endometriosis. She was suffering with endometriosis, and they said, well, you probably never have any children, but she ended up via IVF having an embryo that was placed, and she already started bleeding, and she was oh, she had so many symptoms of B12 deficiency. But the history, and then she started already bleeding in the pregnancy, and she kept bleeding, but she still kept the pregnancy until enough time. So the baby was born. It's a complete miracle. But the baby is crying all the time. Oh, so they hope to get a relief with swallowing less air. So you want that baby to be able to go up and down to the palate with the tongue. And if it's there, it can swallow a lot of air. So the people think when you have a tongue tie release, it doesn't swallow so much air because it can make vacuum in the mouth with the tongue. And so this baby is crying all the time. They think of swallowing air. But then I hear this whole background story of her being always tired, being anxious, depressed, not being able to work properly. I said, well, it could also be a B12 deficiency. So it's a lot. People are really suffering.
there's a couple of questions here from Stella, talking about, apart from dementia symptoms, how is B12 deficiency misdiagnosed if a scan has shown Alzheimer's? And then they're talking about, secondly, the molar pregnancy. Is there any way in which a molar pregnancy is linked to B12 deficiency?
A what pregnancy?
A molar pregnancy.
Oh, a molar pregnancy. Yeah. I wouldn't know. I
Not
wouldn't.
sure
I
about that.
wouldn't know. No, I wouldn't know that.
What
No.
about the Alzheimer's part? How is
Yeah.
B12 deficiency misdiagnosed if a scanner? So I'll let you answer that one.
Yeah. So, look, Alzheimer. I'm not an expert on Alzheimer and scans, so I wouldn't know because I'm into the mothers and babies. So, but of course, if there's not enough B12, you can have shrinkage of your brain. So basically, you end up, well, it's like how I felt before I had the B12 injections. It's like you're getting demented.
Yes. Yes, it's
Yeah,
all,
you put your keys in the fridge, and you put your milk in the bathroom, and you think I'm going mad.
mhm. Yes, I think the Alzheimer's scans can look the same as a B12 deficient brain, so when you're doing this, when you're doing a an MRI scan, you put one up against the other, and both of those brains look the same. They're both shrunk. So that's, that's really important. And some people, obviously, there are many different reasons for that, in terms of the Alzheimer's, etc. Then it could be many. A lot of that's to do with metabolism, and if you want to, there's some work by, I can't remember her name, doctor pediatrician in the US, who did some work around Alzheimer's, and she called it diabetes type 3. So it might be worth kind of looking that up, Stella.
Diabetes type 3, yeah.
Diabetes type 3. I'm thinking of a pediatrician whose husband was an accountant, and they got Alzheimer's, and they did some multi-chain triglyceride tests, and they reversed some of the symptoms of Alzheimer's, and then added in B12. It was quite interesting, but it's a long time since I've read it, so I'm not up to speed on it as such. But if you typed in, it's a female, if you typed in the MCT or coconut oil and the stuff, the studies, you might find something on that. Yes, well, it might be a good one, Jay. That one you've put on there may be useful for people to look at it as well. But there was a book produced, and I bought the book, but I haven't got it. I'm in my office at the minute, and I haven't got it here. What would a good B12 level range be for children? Oh, here we go.
Children, yeah, I saw it. They did a study on that in the Netherlands, in Nijmegen, and it's in the show notes somewhere. Because the levels of children they found it were much higher. So the normal what is normal range from adults is not the same as in children. So that's why our children also probably misdiagnosed a lot with having normal ranges.
Have you got anywhere we would find that information?
Yeah, that's in the show notes of the presentation.
Oh, okay, yes. Sorry, I didn't know what you meant by show notes.
So it's in the end of after all the slides, you got all the slides with the studies and the YouTube videos and.
Yeah, they're very good videos. I use them a lot in training, and I think the one we especially like is the Joseph Chandy one, because of course he's our patron, he's our person who started all this, and and his patients were involved in the study. So in the northeast of England, where he was a GP for 50 plus years, I think, and so we always was like that. That's that television the clips of the television program that they did on it. So it was amazing. And the Sally Patchlock ones are excellent too. I use them all the time.
Yes,
they're so good, especially the Dave one, your pediatrician.
That's so striking, amazing.
Yeah. Mary Newton, hallelujah. That's it, Nicole. Mary Newton, you were thinking of.
Mary Newton wrote about it.
Is about the dementia and the Alzheimer's and the MCTs and stuff. It was quite interesting. Yeah, Mary Newton, that's it.
The more people hear about this, the better. So, yeah.
It's so good because we don't really hear much about children and about families and stuff, and and it's severely lacking. I'm also involved with the B12 Society charity, and I'm a chair of that, and we're looking at children's reference ranges, and we're trying to work with NICE to get some children's reference ranges, etc. So it's an ongoing project, but it's so it's so difficult with children in the UK. A lot of people, a lot of mothers accused of things like Munchausen's by proxy, and you mentioned it twice in your in your presentation that's been, and I've had cases where mothers have been accused of such things, and it's difficult. It's a difficult line to walk, and to challenge, as you know, as we all know, I think that is an issue. Dr. Chandy in his book, this one,
Yeah, I have it. Yeah.
yeah, the vitamin B12, he does a protocol for, children in here, which is quite good, but it's not very often used. But it is a big issue, and some people in this group may well have had issues with diagnosis of children, it's just a big
It's
issue.
very difficult because they think it's so sad for the children to get injections and that will hurt them or traumatize them. Of course, it is not nice, but if you really need it, the child also, it should,
It's
yeah.
quite difficult. You got quite a lot of pediatricians. You have to get pediatricians involved, and
Yeah.
they, there's not there's not a shed load of pediatricians around
No.
who know much about B12 deficiency.
Yeah, there are
Yeah.
5 at the B12 Institute in Rotterdam. So, but to try and get there is and they have a waiting list of half a year or something. So it's horrible. Thank you, Annie. We'll be in contact.
Yes, yeah, please do. Yeah,
Very inspiring. Yeah,
yeah,
your work. Yeah.
really good. The kids stuff. I might get you to do something for the B12 Society as well on that, and then to talk to you about that.
Yeah, right. Be
All work
great. Yeah.
together. The charities have really worked together really well,
Yeah.
and we've all got different functions. The
Yeah.
B12 Wake Up group is a big group for
Yeah.
patients. We've got 84,000 people. And then pre-COVID we had 20,000. Now we've got 84. It's incredible. So we're teaching people to do self-injections. I spend a lot of time
Yeah.
doing consultations on self-injections. For people.
Yeah. Yeah. Brilliant.
All over the
Really
world. I got
neat.
one from New York today, so I'm like, oh gosh, some
From
people,
New York.
they
People
come from
from New
all over the
York.
place. Yeah, they come from all over the place. Yeah, but it's good. We've got to help as many people as we can.
Yeah, you must. Yeah, yeah, somehow. Yeah, yeah.
Yeah.
That's great. Yeah. Okay. Well, thanks for having me and have a good night and a good day tomorrow. Okay.
Thank you very much. Cheers. Thanks, everybody.
Bye-bye. Bye.